So sickle cell is a genetic disorder. It's caused by a mutation or a change in the beta globin gene. Hemoglobin is the part of your red blood cell that lets it carry oxygen around the body, and it's made up of alpha and beta chains. And what happens in sickle cell as a result of this mutation is your red blood cell can go from a nice round disc shape into a sickle or a C shape. And those sickle red blood cells can get stuck in the tiny blood vessels that go to different parts of your body, and that can cause pain and some of the other organ complications that we see with the disease.
For a child with sickle cell disease, the Department of Hematology Oncology, the Nemours Center for Cancer and Blood Disorders, is their medical home within the hospital. And children come in for their outpatient visits. If they need a nephrologist, the nephrologist comes to our clinic. If they need a pulmonologist, the pulmonologist comes to our clinic. We have a psychologist who's there every day. We have a social worker who's there every day. The first step in helping families feel safe is communication.
I was attracted to Nemours because of the mission of the organization and the entire culture of the organization that really places the patient and the family at the center of everything. Nemours is an organization that has a very strong set of cultural values that are instilled from the moment you walk in, and it's something that every single person within this organization truly reflects and truly believes.
I want them to know that a whole team is assembled for them. The second thing to know is that we're very transparent. We'll show you on the computer. We'll go through until you understand what I understand, so we can make this plan together. We will always treat their child as though they're ours. If there is a treatment out there, that is the best. Anyone who comes to see us here, that's what they're going to get.
The way that social work can assist with helping sickle cell patients in particular is by being, I like to refer to myself as a mediator. And also as a support system. I look at myself as a mediator in the sense that there are times when families have questions and they're not exactly sure where to go with that particular question. I always let them know you can always reach out to me, and if I don't know the answer, I will find out who has the answer for you.
I think for patients here at Nemours, it's a very patient-family-centered experience. I know that Nemours really strives to provide that experience to the fullest. And I think patients here at Nemours are treated as a unique individual rather than labeled by a diagnosis.
Majority of the time I've learned that, a lot of our families truly just want somebody that truly will listen to them and truly will care about their child. It's not about you just providing the service. It's also about caring about the family and caring about their child. And that is really important to a lot of our parents.
So the COBRI is a wonderful opportunity for our hospital as well as our patients and the care of kids with sickle cell disease across the globe. And that is really important. I mean, sickle cell disease has really been forgotten for a long time. And this is one mechanism that we can use to not only bring awareness to sickle cell disease, but also contribute to the research that ultimately is going to help take better care of kids and keep kids living longer, healthier lives.